My name is Tyler, and I'll be your nurse today. Can you tell me your name?
Avery.
Hi, Avery. Can you tell me how old you are?
10.
Alright. Today you're in for a general survey for your head and neck. So at any point, if you feel uncomfortable, please let me know. Okay, I'm going to start off by asking you a few questions. Do you know what year it is?
2024.
Do you know what day of the week it is?
Monday.
Okay, and do you have access to 3 meals a day?
Yeah.
Your BMI, which is your body mass index, is appropriate for your height and weight and is very good. I noticed when you walked in, your mobility was nice and straight. I did not notice any use of a cane or a walker. Do you use those?
No.
I have not noticed any physical deformalities. Do you have any of those?
No.
I noticed that your posture and position is nice and straight, and your clothes are nice and clean, so you have good personal hygiene. Is English your natural language?
Yes.
Okay, we're going to go ahead and get started with your assessment. We're going to start with your cranium, which is your head. I'm just looking for any lumps, bumps, or bruises. I'm going to inspect your hair. It is light brown in color and nice and clean. Your scalp is also nice and clean. I don't notice any dandruff or redness or infestations. Is there any tenderness when I push?
No.
Okay, great. I'm going to move on down to your face, assessing your sinuses first. This is your frontal sinuses. Any tenderness when I push?
No.
This is your maxillary sinuses. Is there any tenderness there?
No.
Next, I'm going to move on to your eyes, making sure they're nice and symmetrical. I'm looking at your eyebrows and your eyelashes. Can you close your eyes for me? I don't notice any swelling, redness, or draining. You can open your eyes now. Okay, now we're going to do some pupil reactions. Can you look straight for me? Okay. Alright, and this side? Alright, great. Now what I need you to do is look at the tip of this light and the wall behind me. You have great accommodation. Okay, now I'm going to do your nose. I don't notice any swelling, redness, or drainage. I'm going to be looking at your ears. They're nice and symmetrical. I don't notice any redness, swelling, or drainage going on. Is there any tenderness when I touch?
No.
Next, we're going to move on to your lips. I don't notice any redness, swelling, or drooping. We're going to be moving on down to your neck, making sure there's no lumps, bumps, or bruises on either side. Your trachea is nice and midline. Next, we're going to be palpating some lymph nodes, and I'll call them out as I go for you. I'm going to do them at the same time and roll my fingers. These are your preocular. This is your postocular. This is your posterior ocular. Down here in the back is your occipital. Next is your submental. And here is your submandibular. And here is your jugulo-digastric. Here is your superficial cervical. Here is your deep cervical chain. Here is your posterior cervical. And here is your supraclavicular. Next, we're going to be checking your thyroid. Can you look up? My fingers are going to go on each side. Can you turn your head and swallow? Okay, great. Then the other side? Okay, awesome. Okay, Avery, that concludes our evaluation. Do you have any questions for me?
No.
Okay, thank you. Patient is AAO times 3. She consumes a regular diet which includes meat, fruit, and vegetables. BMI was 15, which indicates a healthy range. Posture is erect, gait is smooth and steady. She describes her mood as happy, which is normal for her. Speech was clear and articulate. English was her primary language. She is dressed appropriately for the weather. Clothes are clean with no body odor. Her cranium was smooth and non-tender. Scalp was intact with no redness or flaking. Hair was light brown, coarse, and evenly distributed. Eyes are symmetrical with no swelling or discharge. Ears are symmetrical with no swelling, redness, or discharge. Lips are symmetrical, pink, with no cracking or lesions. Sinuses were non-tender. Neck is symmetrical with no visible pulsations. Trachea is midline. Lymph nodes were palpable and non-tender, and her thyroid is palpable and non-tender.